Welcome to Save As Ability, a podcast to educate and inform you about disability employment issues. My name is David D'Arcangelo, and I'm your disability policy expert. Hey everybody, welcome back for another episode of Save As Ability. And October is National Disability Employment Awareness Month, so I think this is the last episode that we're going to air for October. We have a couple that we recorded previously too, and it's been a good month. We've talked all types of different disabilities. And today, though, we've got a great guest. Dr. Keith Ablow is with us. Welcome, Dr. Keith.
Hey, thanks, David. Thanks for having me on. I appreciate it, man.
You're welcome. And today we're going to talk about a prevalence type that's near and dear to my heart as the father of a daughter with a significant developmental disability, which I guess falls into the cognitive, which is the mental health piece, right? And my brother was also a person with a very significant mental health disability. He was schizophrenic. So who better to talk about than with you, Keith? And I'd like to start within the context. I did some checking here, and there's a lot of different ways I guess you can define it. Are we using the ADA definition, which protects people from discrimination, or are we using the SAMHSA definition? Are we going into DSM and the clinical or even larger measures on like the world stage? WHO has a different definition, but somewhere around, 6% have very significant mental health conditions. And then maybe as much as 24% have some type of mental health that they're dealing with on a daily basis. Can you help us unpack that a little bit?
Well, it's so prevalent, David. And if you think about it, there's scarcely a person that you could speak with who wouldn't know someone, whether a close friend or a family member who has suffered with a significant mental illness, depression itself, panic disorder, addiction is so rampant. You speak to it in your own family. Obviously, in my own family, also a cousin very much afflicted. And so I think that people need to be aware that whatever workplace you're in, you're working with someone who is battling a mental illness. And for those folks who are doing so but can't work, you're not alone. It's an incredible number of those folks who have to figure out, how shall I procure the best and most comprehensive treatment, and then face kind of the hurdles of getting back into the workforce when that's possible for them.
Yeah. And, maybe we could talk a little bit about the stigma that goes along with it, that for so long has really been a barrier in society, I guess, like the way people view it. But do you see that coming down a little bit? Do you see, because it is so prevalent and because so much of these cognitive disabilities are non-apparent, you wouldn't know just by, having a very casual conversation with the person. Can you speak to that a little bit?
You wouldn't, and that cuts both ways. So in one way, you would say, oh, it's sort of fortunate I'm not wearing this on my sleeve. On the other hand, it leads folks to think, well, should I keep this secret? What's the toll to sharing it? Is it something about me for which I should judge myself? The answer is absolutely not. But since it is affecting your capacity to feel strong and your capacity to achieve things smoothly, it's easy, and would be wrong, but it's easy to judge yourself and say, I am not equal to this task. It's not that you're not equal to it. It's that you really, really are working against a scourge. It's easier in a lot of ways if someone could say, my leg hurts so much, right? Or, God forbid, I can't use my legs. That's once removed. Now, it's an incredible thing to have to deal with, but you're able to say that thing, my body is not performing the way that I wish it would.
Right. And it's tangible and you can see it and touch it, and it's.
But when it's inside you and you feel like I am not okay, It's not clear. A couple things. One is it's not clear whether people will understand. It's not clear for a lot of people how to even share it because the words fail people. You try to tell people what terrible anxiety feels like. It's hard to describe. I mean, I've had people say, listen, if you could imagine being on a plane, they're telling you that it's going to crash and you're feeling that way all day. Okay, that brings it home a little bit, but it's very difficult for people to describe it and very difficult for the listener to internalize it.
Yeah, yeah. And we know from the ADA definition of physical or mental impairment. Can you talk to a little bit of because there are so many different data points out there. As I was doing research and just from what I know of disability, looking at SAMHSA, looking at the American Community Survey data, looking at some other data as well, it seems like there's some common denominators there, though. And maybe you could speak to some of those impairments that if people are uh, experiencing those, what they should or shouldn't do. Like it's okay to not be okay, right?
Well, it's certainly okay to not be okay, and it's painful to not be okay. What are some of the common things that people tell me, common denominators? Really, in the realm of focus, I think we could put a big bracket around focus. The ability to actually focus on something that's a task and get it done is impaired by so many different conditions in the mental health arena, from attention deficit issues to major depression to anxiety to, things colloquially called brain fog, but that's not going to qualify. So, and then I would say there's a whole category in the realm of perception. So, as you know from the family history that you shared during the broadcast, people may misinterpret events, be subject to fixed false beliefs, visual or auditory events that are perceptually not correct. And that would be in the realm of a delusion or a hallucination. In the realm of mood, that's another one where people, because they're familiar with the notion of, oh, I'm sad, it may be hard for some people to imagine, no, this isn't sadness, the realm of bipolar disorder or major depression. This is profound sadness accompanied by other things like feelings of guilt, sleeplessness, inability to concentrate. So I think if you had broad categories and said, well, what am I really laboring against? Is it a disorder of mood? Is it a disorder of perception? Is it a disorder that relates to substance
Right.
abuse? And there are folks whose personalities are involved in this because, and again, no fault of their own, but people with, say, borderline personality disorder, they generally, you'd say, well, maybe there's genetics involved, but they've also been exposed to dynamics in their lives that leave them lurching for how to be in relationships, how to conduct themselves in a work setting, et cetera. And while that may not be a DSM Axis 1 disorder, the Axis 2 disorders like borderline personality disorder, they're plagues as well. And sometimes these things go together. I like categorizing because once you have a nomenclature that includes like 300 different disorders, people can sort of feel lost and spend a lot of time saying, well, which one am I, or which ones am I? It might be better to say, well, what am I really suffering with? Is it mood related? Is it perception related? Is it personality related? Is it substance related? Is it attention related? That's a good place to start, and then work with your clinician to say, all right, let's further define this, come up with the treatments, of which there are so many now. It's not like it was. We've
Right.
got lots of different options.
And I value that. I mean, we talk here on Save Visibility all the time. You got to make it a data-driven exercise. You got to bring the scientific method in here. I know you think that as well. Well, as we begin to conclude here, Dr. Keep, for listeners out there, whether they're experiencing these things themselves, we're not talking about transient. We're talking about sustained, kind of states that they're going through. What would you tell them? What would you tell people in their solar system? What are the kind of things that they want to be able to do? Is it, do they go right to a doctor? Do they go to a clinic? Like, give us a couple of pointers here.
Well, first of all, you take it very seriously, and you have to ask the next question. That's sort of what psychiatrists are trained to do anyhow. So if someone says something that hints at them not being okay internally, emotionally, cognitively, or otherwise, you want to ask the next question and really kind of lean in. Do this with your hands. Tell me more about that. I want to understand more.
Yes.
People are looking for that option. Secondly, yeah, I think starting with your primary care doctor, sure, that makes sense. But sometimes you have to do now the legwork of looking at who is the very best that I can access, given that I think what I'm laboring against is X. Because the healthcare delivery system is so fractured now, and so many people slip through the cracks, and there's so many
Wait
substitutes.
times, and
It's tough. So you need a village. It takes a village.
it
You
does.
need your family or friends around you to say, all right, we got this. Let's bring every resource we can. There's so many people with major depression who've never heard of transcranial magnetic stimulation, for instance, TMS. How is that possible? There's a huge percentage of people who won't improve on medicines, but do improve when you add TMS. We're not doing a good job of getting the word out. So you got to hit the AI systems. You got to hit the internet. You got to use your doctor to say, I want it all. Like, we need a real plan.
Right. But starting with that empathy, the good old fashioned bedside manner, I think really goes a long way.
So it totally does, because people are stories. And it's strange to say it, but this listening art of psychiatry has been decimated by folks parceling their time out in 10-minute increments and just writing prescriptions, and then insurance companies saying, well, we don't really want you to talk to anybody. Empathy heals.
The devices and the shortened attention span can't be helping things. They've got to be some attribution there, I would think.
It's absolutely the case. They're training us. Our phones are training us to pay attention for very short periods of time. And also, because you're looking at avatars and you're looking at videos, now you don't even know if the videos are real.
You can dehumanize people pretty quickly.
It dehumanizes, and one of the ways to rehumanize people is actually to listen to them with your heart, ask more questions than even you think you should, and then team up with them. But so much of mental suffering is based in people's stories. They still matter. The medicine can be helpful. These technologies can be helpful, but really, really, your narrative is incredibly important, and getting to the bottom of it and saying, you know what, I think I understand. That's a miracle that heals people. It's a miracle, and we think we should see it under an electron microscope. We never will. It's immeasurable.
Yeah, it's the love factor, right? I mean, at the end of the day,
There is something about empathy that feels very much like love, because you're that connected to
that
the person, and
well-being.
you're resonating with what they're thinking and feeling, and that's saving to people. If people feel like you are a resource where they can literally say what they think and feel for real, then you can save their lives. And that's an amazing thing.
Yeah. Well, Dr. Keith, we appreciate you and the work you're doing. Any last words here before we wrap up?
Um, I think people ought to know that most folks with confronting mental disorders or psychological symptoms get better. There's a sense that you may have, this will never go away. That's not so. The vast majority of people get better, all better. And I think that people should look forward to that and know that they're not alone.
It's a great way to end. There is treatment. There is hope.
There is.
We
And
appreciate
thanks
you,
for having
Dr.
me,
Keith.
David. You're a source of hope in the world.
Oh, well, thank you. We try to spread joy. Angel buttons bring joy. You know that. So we appreciate you, Dr. Keith Ablow, and our audience here. If you could help us, subscribe, like, share, comment. Comments and shares really do help us the most. We appreciate that to get our message out. So once again, thank you, Dr. Keith Ablow, for joining us. And thank you for joining us here on Save Visibility. It's David D'Arcangelo. I hope you have a great day.
For more information about disability employment issues, please visit our website, disabilityemploymentsolutions.com. The Save As Ability podcast is available on Apple Podcast, Spotify, our YouTube channel at Disability Policy Expert, or wherever you stream your podcasts. Subscribe, stream, rate, and review our shows. Your ratings and reviews help our show reach new audiences. Produced by Pod Pro Entertainment. Save As Ability lives within a network of podcasts located at podproentertainment.com. #TheNewRadio. Again, my name is David D'Arcangelo, and I'm your disability policy expert. Until next time, thank you. I hope you have a great day.